everyone, welcome back to my YouTube channel. I hope you all are fine. Let's start the video. There are three fundamental features by which most benign and the malignant tumor can be distinguished: differentiation, anaplasia, and local invasion and metastasis. In general, the rapid growth also signifies malignancy, but many malignant tumor grow slowly, and as a result of the growth rate is not as reliable a discriminator between the good and the bad actors. Nothing is more important to the patient with a tumor than being told it is being benign, although some neoplasm defy easy characterization. In most instances, the determination of the benign versus malignant is made with the remarkable accuracy using long established clinical and anatomical criteria. Differentiation refers to the extent to which a neoplasm resembles their parenchymal cells of the origin, both morphologically and functionally. Lack of the differentiation is called anaplasia. In general, benign neoplasms are composed of the well-differentiated cells that closely resemble their normal counterparts. A lipoma made up of mature fat cells laden with the cytoplasmic lipid vacuoles, and a chondroma is made up of mature cartilage that synthesize their usual cartilaginous matrix, evidence of the morphological and functional differentiation. A well-differentiated benign tumors mitosis are usually rare and are of normal configuration. By contrast, while the malignant neoplasms exist, a range of the parenchymal cell differentiated more exhibit morphological alteration that betterly their malignant nature. In well-differentiated cancers, these features may be quite subtle. For example, well-differentiated adenocarcinoma of the thyroid gland may contain normal-appearing follicles. Its malignant potential benign being only revealed by invasion into the adjacent tissues or metastasis. The stroma carrying in the blood supply is crucial to the growth of the tumors but does not aid the separation of the benign from the malignant ones. The amount of the strong connective tissue does, however, determine the consistency of the neoplasm. Certain cancers inside induce a dense abundant fibrous stroma, making them hard, so-called serous tumors. Tumors are composed of differentiated cells are said to be anaplastic, a feature that reliable indicator of the malignancy. The term anaplasia literally means backward formation, implies differentiation or loss of the structure and functional differentiation. Normal cells, if it is not known, however, the differentiation of the normal cells it is not known, however, that at least some cancers arise from the stem cells in the tissues. In these tumors, failure of the differentiation of the transformed stem cells rather than defibrinated of the specialized cell account for their neoplastic appearance. Recent studies also indicate that in some cases, de-differentiation of the parentally immature cells occur during carcinogenesis. Anaplastic cells often display the following morphological feature: pleomorphism, variation in the size and the shape; nuclear abnormalities consisting of the extreme hypochromatism, dark staining, variation in the nuclear size and shape; unusually prominent single or multiple nuclei, while enlargement of the nuclei may result in the increased nuclear to cytoplasmic ratio that approach 1:1 instead of the normal 1:4 or 1:6. Nuclei may attain a tough-siding size, sometimes approaching the diameter of the normal lymphocytes. Tumor gate cells may be formed, and they are considerably larger than nearby cells and may possess either one innermost nucleus and several nuclei. Atypical mitosis, which may be numerous and anarchic multiple spindles, and may produce triple or quadrupolar or multiple mitotic figures. Loss of the polarity such that the lymphatic cells lack a recognizable pattern of the orientation to one another. Such cells may grow in the sheets with total loss of the communal structures such as glands are stratified squamous architecture. Well-differentiated tumors are likely to retain the functional capabilities of their normal counterparts, whereas anaplastic tumors cells are much likely less to have specialized functional activities. For example, benign neoplasm and even well-differentiated cancer of the endocrine glands frequently elaborate the hormones characteristics of their cells of origin. Similarly, well-differentiated squamous cell. Cancer of endometrial gland frequently elaborate the hormones characteristic squamous cell carcinoma produced like keratin. It is just as undifferentiated. Hepatocellular carcinoma secrete the bile. In the other instance, anticipated functions emerge. Some cancers may express fetal protein not produced by the comparable cell in the blood. Thank you so much for watching the video. Keep watching, keep supporting.